Okay. Hello everyone. Okay. Welcome to Facebook and Instagram live session for Alpha IVF Women Specialists. So today we have Miss Adeline here, our staff nurse, who will talk about women reproductive system. So if you guys have any questions about women's reproductive system, you can just type your question. You can just type your question here in the comment section below and we will answer your questions accordingly.
Okay. Thank you, Putri, for the kind introduction. Hello, everyone. Okay, so today I'll be talking about two common female issues. Number one, which is PCOS, and number two, which is endometriosis. And then followed by 5 facts about your reproductive system. So before we go into all these details, okay, let me just explain briefly to you about our women reproductive system. Okay, so as you can see the slide here, I'm sure you can see. Okay, so here is our cervix, and then our vagina. So the function of this area here is to assist the sperm to swim, okay, to swim up past the womb all the way to the fallopian tube to meet the sperm. Okay, and then of course here we have our uterus or our womb. So this is where, if let's say conception happened already, and then the embryo or your baby will implant here, and then if you happen to be pregnant, you're likely to grow until your full-term pregnancy or until when the baby is ready to be delivered. Okay, now followed by your fallopian tube. So this is also very important because this is where the sperm and the egg will meet to fertilize and then become an embryo, which then the embryo will travel down the fallopian tube all the way to the womb lining to be ready for the implantation process. Now, of course, we have our precious ovary here. This is where we store all our eggs. Okay, and in fact, for female, for women, the moment we are born, our number of eggs is already fixed. So let's say a female of, let's say, 40 years old, at the age of 40, she still can have a lot of ovarian reserve. Ovarian reserve means to have a lot of eggs, follicles stored in her ovary, versus a female who is 40 years old, which she can already enter into an early menopausal stage. So what happens during a menstrual cycle? Okay, so you can see here it happens into 3 phases. So you have your follicular phase, your ovulatory phase, and your luteal phase. So let us look into what is a follicular phase. So you can see here this image. So this is your womb, okay, and this is your womb lining here. So on your first day of your period, while your period is shedding away, the womb lining is shedding away, period coming out, what happens in your ovary is that usually one follicle will slowly start to grow, and this follicle will start to grow and mature until it reaches on your day 12 or day 13 of your period cycle. This is when once the follicle has reached its stage of maturity, it will ovulate out from your ovum. So this will be your ovulation stage. So this is when when during your ovulation phase, you and your husband or your partner, you guys have get together, have sex, and that's where conception might happen. Now, however, if let's say you do not have any sex or pregnancy did not happen, then we'll move on to the luteal phase. Luteal phase, it is whereby when pregnancy does not happen, your womb lining, okay, will slowly start to thicken up again. Why? Because in preparation for another cycle of period. Okay, so now that we are refreshed with the anatomy and physiology of your reproductive system, let us move on to what is PCOS. Okay, so PCOS means polycystic ovary syndrome. Poly means many. Cystic ovary is cyst-like ovary. Now, why? Because let's say during an ultrasound scanning, if let's say a lady do not have a PCO, okay, her ovary will look like this. This is how a normal ovary look like. So you have your one follicle that is growing until mature and then released into the fallopian tube. But however, in a PCO ovary, you see multiple immature follicles. Why? So the cause of a PCO is unknown, but maybe also it can be mostly because of this hormonal disorder factor. Okay, so and then why and how it happened. Okay, the sign and symptom, how to know that, oh, I'm having a PCO. So you can look into the sign and symptoms. So number one is, of course, your irregular period cycle, whereby your cycle may be more than 35 days. In some women also, they might not even have period for 2 months or 3 months or even 6 months straight. Yes, it happens. Why? Because remember when I mentioned that each time when first day of period, your follicle will be released. But however, in the case of PCO, you do not ovulate. So imagine there are so many small little immature follicles retained in your ovary. So hence, that is how we say it's a PCO. Like you can see here, there's many little follicles, and also if you can see into this model here, you can see a lot of small little follicles. Okay, now we will move on to the next sign and symptoms, which is because due to the increase of the male androgen hormone. Okay, so then you may notice that, how come I have a lot of increased facial hair, around here, on your hand, and then you might notice, how come it's like I have a lot of acne, or sometimes you may feel like, why I'm losing a lot of hair, it's like people will have this quite a male pattern baldness, all because of this excessive male hormone called the androgen. Okay, now another sign and symptom would be, of course, your weight gain. You will notice that, I'm increasing so much weight. It's like I do my regular exercise, I eat my healthy diet, but still it's so difficult, to lose weight. And another sign and symptom would be the hormone changes. Hormone changes like, today, I may feel great, fine, but the next day, you may feel very irritable, you're having mood swings. So these are the few factors and the sign and symptoms from a PCO. Okay, and the cause is unknown, but maybe is heredity, and also studies also suggested, okay, maybe it's due to your excessive androgen, excessive insulin, and also maybe due to a weakened immune system. Okay, now we will move on towards, so what are the few potential complications that might happen, if let's say a female presented with a PCO. So number one, you have abnormal uterine bleeding, you of course will have fertility issues, and number three is obesity. Okay, why? Because due to the can be a metabolic issue, because, and then your body tend to be insulin resistant. So therefore, you have extra glucose stored in your body, and also that's why it make you extra weight gainer. And then how would PCO look like in an ultrasound? So, and also a way for doctor to diagnose is that during the ultrasound scanning. So if let's say a normal ovary will look like this, you can see here. Okay, a normal ovary look like this, whereby usually on your day 12, day 13, you will have one dominant follicle will start to grow already. It's big. But in a PCO, okay, you can see here the little black dots. So multiple little follicles, retained inside your ovary. And so besides seeing this multiple follicles during the ultrasound scan, so number two would be doctor will see of enlarged ovary. Okay, and then so the treatment. So for those who are just joining us, welcome to our live session. So currently I'm on the topic of a PCO, and do let us know in the comment section if you have any question to ask, which I will help you later on. Okay, so let us move on towards the treatment for PCO. If let's say your PCO will be mild or moderate, then doctor might also just subscribe to you some hormonal pills. But if let's say if it's severe, then he would suggest for a surgery. So this surgery called a laparoscopic ovarian drilling. So laparoscopic means it's a keyhole surgery. So you must be under a full sedation. It's a daycare procedure. You have incision, 3 incisions usually on your belly button, on the side of your abdomen, your tummy area, and then one more is just at your pubic area. So incision is only like very small, only 1 cm. Okay, the length of the procedure is around 45 minutes now. So what happens during the surgery, and the purpose of this is to drill away, you can see this image here, all the extra unused follicles. So why and how does this surgery helps and aids in the PCO women? So number one, it is that it can regulate the hormone level. Number 2 is to improve the ovulation, and of course number 3, it will improve your menstrual cycle. So and the fact that in fact in Alpha Fertility, our founder Dr. Colin Lee, he has formulated a dreaming formula that is able to preserve the woman's potential egg. So since then, a lot of our specialists, they able to do this surgery and also preserve your eggs, and a lot of patients, as seen our doctors here in Alpha Fertility, they're even able to conceive naturally after the surgery. So that's a good news for those who are, maybe that your options are maybe to do a laparoscopic ovarian drilling, but you're not sure. So I would say be hopeful. Maybe after you have done the surgery, you can be one of the patients that able to conceive naturally. Okay, so now let's put like about medicine, and surgery aside. Let's talk about self-care. So as an individual, how can I make my quality of life even better while living with PCO? So of course, number one, doctor will always say, try your best to lose weight. Okay, why? Because it's best to be within your BMI range. So number one, of course, you have your healthy diet. Go on your healthy diet, eat more fruits, vegetable, protein. Number 2 would be go on a regular exercise. And then followed by, you can do your meditation, your yoga. So all these things maybe in a long run, can help whenever you're feeling so stressed because of all this hormonal imbalance, and a mood swing. Okay, I'm sure you want to have a nice, lovely day, where you can go to work, or spend time with your family members or your friends without having all this mood swing and irritability. Okay, and besides that, continue your multivitamins, and getting enough sleep also will help you in the future and in the daily life. Okay, and also you can always look into the platform of like a Facebook or Instagram. There are many people who are out there. They are willing to reach out to those who are having PCO. So there are a lot of support group out there. So join the support group so that you won't feel like, oh, I'm so alone. Am I the only one going through this? My life is so difficult. Why am I the only one? Don't think that way. You'll be surprised. There are many women out there having PCO issues too. So now that will be about PCO. Okay, I hope you guys are able to follow along with my explanation and my sharing. Okay, so now we will move on to endometriosis. Okay, so what is endometriosis? Okay, so endometrial, okay, pertaining to your womb lining. So cis is pertaining to infection. So what exactly endometriosis is? Okay, so the cause of endometriosis is unknown. Okay, but maybe it can be the common hypothesis will be related as a reverse or retrograde menstruation. So in a layman term, what is this retrograde menstruation? Even to pronounce it's so mouthful also, right? So basic to say is that on your first day of period, your blood supposed to flow out, isn't it? Flow, okay. But whereby in endometriosis, your period, instead of flowing out completely, some of it goes back, flow back past your womb, past for your fallopian tube and out here. So you can see your menstrual blood from the endometrium, okay, is your endometrial tissue lah, okay, will flow out here, and it possibility and it might and it may implant land on your fallopian tube, your ovary, and your womb and your pelvic region area. So endometriosis is a disease that is a progressive. So in the long run, it can be harmful to your reproductive health also. Why? So endometriosis, we have 4 stages. The first one you can see, okay, it's very little only. Okay, quite a chocolate cyst lah. Okay, little bit, you know, squatting here and there. Okay, stage 2, you see already start to infect your left and right ovary. Okay, then stage 3, oh, you see over here, largely start to infect your ovum already. Okay, and then your fallopian tube also will be swollen, it will be infected also. And now stage 4, severe already. You can see here, noticeability, no more eggs already. Why? Because the endometriosis has already consumed a lot of your eggs. And besides that, it has also created an adhesion whereby, for instance, like your tube and your ovum egg stick together already. Okay, so all this endometrial disease, okay, will lead to your chronic inflammatory, because which is a chronic infection. Okay, it will lead to tissue scarring and adhesion. Okay, then we will move on to what other sign and symptom. Okay, so how would I know? Sometimes I so confused, you know. Oh, people will say that my period sometimes few days spotting, then no more. Sometimes just chocolate color, sometimes just pink color, or sometimes the flow is so heavy, stop, and then heavy again. Very confusing, right? Okay, so let us look into the sign and symptom. So number 1 is sharp deep pain during ovulation, followed by pain during intercourse, you know, and of course extreme pain during your period. And also maybe some people, they will feel pain during when you want to pass urine, you know, or you want to go to the toilet to do number 2, you feel pain. Okay, then the next one would be a chronic pelvic pain and also abnormal menstrual problem lah. So usually when patients, they come here, you know, the presenting problem would be definitely period pain and infertility issue, because all these blood chocolate cysts, it will hinder the process of the conception also. Yeah. Then you would ask, oh, so how would I know? How will doctor diagnose that I have endometriosis? So when you come and see doctor, okay, definitely doctor will do ultrasound. So if let's say endometriosis is presented, he will definitely be able to diagnose. Okay, and another type of diagnosis would be through a laparoscopic surgery again. Okay, how does the laparoscopic surgery help? So when doctor is performing the surgery, he will able to view directly into your reproductive area whether there are any endometriosis, whether he will see any all these chocolate cysts. If it's presented, he will be able to remove the chocolate cysts, and then in hope to make your reproductive health even better, thus hoping that you're able to improve the process, you know, to help you to get pregnant. Okay, and then now, as for the self-care part, you know, what can an individual do to help, you know, in terms when you're living with the endometriosis? So here are a few examples. Okay, so number 1, of course, your healthy balanced diet meal, and number 2 would be your exercise. Okay, and number 3 is that what you can do is that there are so many applications, apps on period, okay, in iPhone and Android. So you download them. So each time whenever you're having unusual bleeding, spotting, you make a note so that when you see a doctor, you tell this to the doctor, and it helps for doctor to get all this information to able to give you a proper diagnosis. Okay, and then of course during your menstruation, if you're feeling, oh, so much cramp, so much pain, get a hot pack and comfort your tummy area, your abdomen area. And of course, lastly, there are also support group, in endometriosis. Okay, so you can share your concerns, and maybe your own endometriosis group, the peers, are able to share their tips for you. Okay, and also, if let's say you would like to know more about this PCOS and endometriosis from doctor's point of view, you can log into our Facebook, okay, because Dr. Lam and Dr. Leong also have touched on this topic before. Just go there and view for more information. Okay, so I hope many of you are following me, and once again, welcome for those who have just joined in our live here. So I'm on the topic of PCO and endometriosis. So now I will move on to 5 important facts about your reproductive system. Okay, so let's go into fact number 1. General health does not predict your reproductive potential. Yes, it is true. Why? Because we may look great on the outside. You can have the perfect BMI, you can have your regular meals, your healthy diet, you go exercise every day, all kinds of sports, but as long you do not get your reproductive health check, okay, we don't know what's happening inside. Okay, and then now fact number 2, your reproductive potential is determined by egg quality, not usually by uterus or other structures. Now it is true. Why? So we shall move on to fact number 3 to find out more. So fact number 3 would be your reproductive potential will never be as good as it is today. So the fact is that for us female, once our period come, we're having our menstrual already. So each month our period come, we will, if it's not used, we will lose our egg quantity. And when we reach older, by our age, our egg quality also will start to drop. Okay, fact number 4. Is it possible to lock your biological clock via egg freezing? Definitely yes. And the best time to freeze your egg would be below 35 years old, because once we hit the age of 35, we will lose half of our egg quantity. So the aim is to harvest as much as egg as possible and to freeze them for your future use. Now, fact number 5 is your resource is limited. Now, what does this mean? So maybe is that previously you don't know what is PCO, or you don't know what's endometriosis, but now that you know and it begins to sink into you, oh yeah, maybe that's why my period is not coming. Maybe that's why it's so hard to get pregnant. So now that you know certain facts here and there, it's never too late to seek for a professional help. Okay, so far I hope that you're able to follow me, and then do let us know if you have any questions from our viewers out there.
Okay, thank you, Miss Adeline, for sharing. But we do have questions for you. Okay, one question like, can I get pregnant if I have PCOS?
It is possible to get pregnant while having PCO. So some couples, they come to the clinic. So after doctor consultation with them, after doctor diagnosis. So some of the approach that doctor will offer is maybe to do a IVF or test tube baby.
Okay. So another question is, what is the best way, in your opinion, that we can treat PCOS? Other than exercise, or should we take supplement?
I would say some patients, okay, some women they already know they have the PCO and they already consulted their own OB-GYN doctor, and some of them are given metformin, So because why studies have shown that continuing taking metformin will improve the metabolic syndrome and improve ovulation. So there are some patients who come here, oh yeah, I have a PCO, I've seen my previous doctor and he's giving me metformin, So these are the ones that I would, coming from the nurse's point of view, but if to know what other treatment would be really have to depends on how mild, moderate, or severe is your PCO symptom is. Then doctor will able to advise on the next treatment.
Okay, another question is, can I pick up all these problems in my first consultation with my doctor? He's very keen to have a baby soon. Wow. Yeah, you
Yes,
should.
yes, you can. Yes,
Yeah.
yes. Because when you come to see a fertility doctor on your first visit, doctor will usually do two type of scanning for you. Is first one is from the tummy, and second one is a vaginal scan. So usually on this first visit, he'll be able to diagnose you.
Okay, for egg freezing, is it painful? And how was it?
Well, to go to the process of egg freezing, maybe some women will feel the painful part is when you have to do your injections. To do egg freezing, you have to stimulate your eggs to grow big, so that you can harvest. So the injection process is about 10 to 12 days. So some women may feel that, oh, I'm so scared of injection, So in their mind, you already think, yeah, injection very painful. So that is the painful part, Otherwise, when doctor need to harvest the egg, that will be under a full body sedation, so you won't feel a thing. You'll be asleep. Only when you wake up, you may feel a bit of abdominal cramps and a bit of a nausea, because side effect of the anesthesia.
Another question that we received, when should I start seeking for fertility treatment? Okay, this is like common question that we received.
So this is a very common question,
Yeah.
and especially if you have been trying to conceive for the past 6 months, even to 1 year, without using any contraceptive pill, without any condom. So do set an appointment to see a fertility doctor soonest as possible, because our biological clock is ticking.
Yeah, true.
Yeah.
And then, is there any medication to cure PCOS?
Medication to cure PCOS. So that one best is for a doctor to explain from a professional point of view, from the medical doctor point of view.
Okay. What do you think? What is the best age for egg freezing? Is it like in 20s or like prefer 30s, or is it better earlier?
The earlier the possible is better, yeah. Especially if you're in 20s, if let's say you're below age 35. Yeah, it's don't wait too long, yeah, because otherwise, every month we lose our egg quantity also.
And then we have questions like, how long can I keep my eggs?
So how long you can freeze your egg in our lab here? You can renew your egg freezing maintenance yearly. You can keep up to 5 years, 6 years, also can, until you find your Mr. Right.
Okay. So do you think like should I lose weight to avoid from this PCOS and endometriosis problem, or keep myself healthy is the best way?
The best is to keep yourself healthy. Okay, but of course, if you know that you have PCO, yes, then the way to go is definitely to lose weight. The best is to keep your BMI weight in range.
Okay. Is there any hope to conceive in late 40s?
To be honest, the challenge to get to conceive in your late 40s will be very, very challenging. So, but for that, definitely you need to come and see a doctor for scanning, because most importantly, doctor need to check what and how much is your eggs left in your ovarian reserve, which is how many eggs left in your ovary.
Yeah, true. So if you guys have any more questions, just type in the comment section below, or I hope you guys learned so much through this session. If you know someone or anyone, or if you have the same sign or system, you should come over to Alpha Fertility Specialist and get an appointment now to check with our doctor for more details.
I encourage a lot of women out there. You might feel scared, afraid. You know that why am I not conceiving? I've been trying for so many years. I follow my ovulation timing. I eat regular, all sorts of multivitamins. But why am I not getting pregnant? So, if you are feeling so afraid, I encourage you to take the courage, just to make the phone call first to see a doctor. Once you make the phone call, you have already done yourself a favor. You have done yourself a first step. When you come to the clinic, you will see nurses first because we will explain to you, okay, the process, what's going to happen throughout the entire session on your first visit, and also to tell you, okay, may give you a fertility counseling on IVF, or maybe on egg freezing. And also during the consultation, while doctor is doing a scanning, there will be a nurse there to assist you and the doctor, so you won't feel so nervous, so scared.
Okay. Do you have package for IVF here? Do. Of course we do.
Yes. So now we are having a promotion, which is the Smart IVF package for our local patients out there, and also we do have the IUI package. Feel free to log into our Facebook to view the promotional package.
Okay, so another question is there anyone chat or online appointment before since to meet the specialist?
Sorry?
Is there any chat online appointment that we can do before we meet the specialist? Online appointment. Well, they can refer to customer service.
Yeah, you can give us a phone call via customer service and also through our marketing department, or our Facebook Messenger to get the initial appointment date and time.
Okay, for someone who is having ovarian cyst, do you recommend to do surgery first before IVF?
Well, that one would be the best person to answer would be a doctor. Yeah.
And then can you actually explain what is smart IVF?
Smart IVF would be, let's say it's a package that includes your injections for the stimulation for the egg harvesting, includes the process of the egg retrieval, okay, and all the technologies that is used in the laboratory, such as ICSI, and then we culture the embryo until the day 5 and day 6 embryo, your blastocyst culture, and also it includes we do a fresh embryo transfer and includes your doctor consultation and the scanning. So this package is starting from the beginning of your medication, and also it will end until it covers until the day that you come and do the beta HCG, the blood test, to check whether you're pregnant or not. So this is the package for the Smart IVF.
Okay. And then can you explain the IUI package? Okay.
IUI package. So the IUI package would be it's like you do one time already, okay, and so happen if touch wood you didn't get pregnant, then you can do another cycle, but no need to pay because it's like already you're paying one price for 2 IUI cycle.
So I guess that's it for today. Thank you everyone for joining us today. So don't forget to follow our social media, Facebook, Instagram, and YouTube to stay for update, promotion, and latest news about Alpha IVF Women Specialists.
Yes. So thank you and bye.